That's
I know. It was like, governor.
Only one microphone today.
Shocked.
Thanks for your patience. We're here to announce a situation involving a traveler who was confirmed with the novel coronavirus. Now, many of you know it's being called COVID-19. So when we refer to COVID-19, we're referring to the same virus. After our brief overview, we'll open up the floor to questions. We have a number of people here who are able to answer questions, including Chris Datum, Chris is up in the front row here, and Hilton. Chris is the director of the Hawaii Tourism Authority. Hilton Rathel. Hilton, thank you for coming. He's the Healthcare Association director. Tom Travis is here. Tom, there you go. And Jade Butai. Jade, thanks. Dr. Ireland and others. If there are questions, Tom Travis, thank you for coming. Of course, we have Governor David Ige here to open the press conference. So thank you.
Sure.
Governor.
Thank you so much for joining us. We do believe that this is a serious concern, and I just want to assure you that this scenario is exactly what we've been preparing for and are prepared for to respond. I have every confidence that all of our partners, State Department of Health, county, private sector providers, are fully aware, and we do have systems and protocols in place to respond to this situation. All of the state agencies have been preparing for exactly this scenario where someone visits the island and the virus is present. We are taking the necessary actions that we need to ensure the safety of our community. And what we know at this time is that an adult male traveler was in Hawaii from January 28th through February 7th. When he returned to his home in Japan, it was confirmed that he had the COVID-19 virus. So I do want to make it clear that we have not a confirmed case of the COVID virus here in the islands. I know that this raises a concern for all of us. The State Department of Health, Dr. Anderson and his team will provide much more information on this situation. There is still much that we don't know. We're in contact with the Japanese government to do what we would always do, understand where he was, who he might have had contact with, and investigate all of the contacts so that we can assure that there is follow-up and we can assure that that there is no virus. I know that we are ready to address the situation. As I said, this is the situation that we have been preparing for. The county and private sector partners have implemented the procedures and protocols as we expected. We also ask the community to stay informed, to take preventive measures to prevent the spread of respiratory illness, including the flu. Staying at home when you are sick instead of going to work, washing your hands often, covering your cough and sneezes. That is the way that we believe this virus is spread. It's very important, I think, that we all take responsibility for keeping our community safe and limiting the spread of disease in general, and obviously the COVID-19 virus specifically. And with that, Dr. Anderson.
Thank you, Governor. This morning, the Department of Health was notified by the Centers for Disease Control that an adult male traveled from Japan to Maui from January 28th through February 3rd, and then traveled to Oahu from February 3rd to the 7th. He returned to Aichi Prefecture in Japan and developed more serious symptoms there and sought medical care for those symptoms, and was tested when he was there for COVID-19 and found to be positive. During his time on Maui, He did not have any symptoms. He was healthy and well. During the time on Oahu, he did develop cold-like symptoms, some of the preliminary symptoms that you would expect to see with COVID-19, but no fever, which is important. As soon as the Department of Health was notified this morning, we began to gather information and work on tracking any close contacts. That's normal procedures for this situation, and it's those individuals who we're most concerned about. As far as we know, the disease is not transmissible unless you become symptomatic, and then you're worried mostly about people who are in close contact with the individual for prolonged periods of time. Fortunately, the individual did not have any symptoms while he was traveling on Maui, and again, he developed cold-like symptoms with no fever when he was here on Oahu. The Department of Health is sending out a medical advisory to all the healthcare providers in the state to be on alert for possible cases. They've been previously notified about the disease, and they're ready and willing and able to attend to anyone who does show signs or symptoms of the disease. And we're also consulting with federal and county partners on the most effective measures to protect our residents and our visitors. We actually have a representative from the Centers for Disease Control with us today that was assigned to help us deal with situations just like this, who is serving as a liaison for us in the federal agencies. Because you're going to probably ask this question, I wanted to share with you that when he was on Oahu, he did stay at the Waikiki Inn Hilton Grand Vacation, which is a timeshare in Waikiki. They have been notified about the issue, and they're helping us and cooperating with us and trying to identify any possible close contacts while he was here. We're still gathering information. Obviously, we're learning a lot more about his travel history when he's here, and we'll be able to identify additional situations where there may be a risk of transmitting the disease as we find out more. But we're of course focused on this, and we'll continue to investigate this issue until we are sure that there hasn't been any undue exposure to Hawaii residents. Dr. Sarah Parks here, and I'd like her to talk a little bit further about how we're going to be proceeding from this point on, how we're going to be investigating contacts and pursuing this to again be sure that no one here in Hawaii has been exposed, and if they have, that we take appropriate precautions. Sarah?
Thanks. So as already been outlined, a lot of what we're doing is notifying partners, the medical advisory for our healthcare partners, to make sure that they're alert and aware of the situation, and let us know if they have a patient who, for whom they have no other diagnosis and potentially could be presenting with this disease. However, what should be reassuring is the person was asymptomatic while on Maui and had only respiratory symptoms, cold-like symptoms, and no fever while on Oahu. That's somewhat reassuring to us because we know that when you have the fever, you're probably more likely to be more infectious. However, as a precaution, we are working with partners to identify potential close contacts, because we know the risk is for those who have that prolonged face-to-face close contact. And so we are consulting with our Japan colleagues. So the Japanese consulate is helping us to track down information as to the exact itinerary of this person. We're also working with CDC colleagues to also try and gather that information, because our focus at this point is to try and understand who potentially this person may have had close, prolonged contact. If you've had fleeting sort of in passing, you passed in the hallway, that is not our focus. Our focus is who this person might have sat down with, had conversation with. Those are the kind of things that we're looking for. Once we identify those persons, then we would make sure those persons would be aware and home monitored, or if the situation requires quarantine. If they do fall ill, that they are appropriately evaluated, and if they fulfill the criteria for testing for this virus, we would do that. So that's what we're doing right now. And I just want to reiterate, the messages that we've been putting out before are especially important now. This hopefully is a reminder and a note for everyone. This is why we practice the infection prevention measures we've been talking about. washing your hands. Washing hands is important because we touch our face often. We want to make sure if we touch our face, which we should try to avoid doing, that it's with washed hands, not an unwashed hand. And also, if you do become ill, stay home. Do not get on the bus. Do not go to school. Do not go to work. Don't go to a concert. Please stay home if you're sick until you recover. And everyone, please take care of yourself, because having good health to begin with when you have infection it goes a long way in recovery, making an eventual recovery. So with that, I'll close.
Let me just make a couple of closing remarks, and then we'll take some questions. So I wanted to emphasize that the department is committed to sharing information as it becomes available, and we will do so. We urge people not to spread misinformation or inaccurate information that's not confirmed, but please keep updated on what's happening here. We get dozens of calls of rumors and other information every day, and it's important in this situation to check your sources and be sure that the information that you're hearing is accurate. I would also like to remind people to take basic precautions and stay at home when you're sick. Don't go to work. Wash your hands often. Cover your mouth when you cough and sneeze. Stay away from others when you're ill, and I would certainly avoid any school or other social gatherings. And we can prevent a lot of illness if we follow these steps, even the flu, which is a big problem in our community today. With that, let me close the formal part of the presentations here, and we'll try to entertain any questions. Again, we have Chris Tatum with us, Jay Boutte, who's the Department of Transportation, Hilton Rethel, and Tom Travis, all here to answer questions about issues they may be able to help with.
Bruce, is there any confirmation that this person now in Japan went to a health facility or medical facility in Hawaii?
No. As far as we know, he didn't seek medical care when he was here. He did, however, go to a hospital in Japan when he returned, and he did develop significantly serious symptoms when he was there. I won't go into any detail on that, but that's how they identified the individuals having been infected. Again, he did not seek medical care as far as we know when he was here in Hawaii.
Because he was here for 11 days, is it possible that he was able to contract the disease when he was still in Japan before he came to Hawaii, or is it pretty sure that he contracted it while he was here?
Okay, so the assumption is because he became symptomatic during his travel here on February 3rd, that he most likely was infected while in Japan or potentially in transit here, and then was diagnosed when he returned to Japan. Does that answer your question?
So he was while in Japan?
He was probably infected in Japan or while traveling here.
Let me just refresh your memories then. So the incubation period is somewhere between 2 and 14 days. Some think it may be even longer than that. And if you look at the time frame here when he actually started developing symptoms, which is probably somewhere around March 3rd.
February 3rd.
You go back to February 3rd, I have a hard time with that.
Dr. Anderson, do you know?
Wait, can he finish the question
wait.
first?
It's a very good question. Let me speak to that for a moment here. So the individual developed symptoms on or about February 3rd, and based on what we know about the incubation period for the disease, it's very likely the individual was exposed in Japan or in transit coming to Hawaii and became sick when he was here. This is how most cases in the United States are being identified. After someone's been exposed, and when they get home, they develop the symptoms. Here, the person was traveling and developed the symptoms to begin with, at least in Hawaii. But again, all the evidence we have is that he was infected when he was in Japan or in transit to Hawaii. We'll know more as we get more information, but it's probably never going to be certain as to where the individual was exposed. But the best evidence we have suggests that he was infected while he was in Japan before he came to Hawaii. So your question?
Sorry about that. Do you know if he was with anyone closely while he was here, like in the same room during his stay?
He was traveling with his wife, and obviously that would be a contact that we'd be concerned about. As far as we know, his wife is still with him in Japan. is no longer here.
But he's okay.
We have no information on any other travelers. We only have information on this particular traveler. And again, as I said, we're still investigating. We do not know about any other close contacts, and that is the focus of our investigation.
What can you
What's
share
your
with
line?
us as far as his exact itinerary at this time? What town he traveled
We
to?
we have very limited information. All we know are the date, what we've actually provided to you. We know he was in Maui at the start. He was asymptomatic, and our focus really is on his whereabouts while he was on Oahu, because that's when he developed symptoms.
So part of the protocol is to work with the government in Japan and find out what his specific itinerary was while in the islands, and evaluate and identify any potential contacts, and then the department would follow up with those people. So you know exactly what we know at this point in time. We're committed to keeping you informed of what we know. As we get more information about his specific itinerary or places that he visited, then we will examine that and identify any of those workers that might have been exposed that we might want to contact and make sure that they follow proper hygiene and can stay connected with their medical providers.
So
Let me just add to that, because you may ask this question. So what do we do if we find a close contact? Is probably the question you're thinking. If we find a close contact, obviously his wife would be a close contact, but others who were in close contact for prolonged periods, we would implement the same process that we typically do, which is to restrict that individual and isolate them in their home or in their lodging, wherever they may be, for a period of 14 days, so that they are not at risk of transmitting the disease to somebody else. Again, that would be only for the close contacts. For people who are casually exposed, say happen to be walking in the same room or walking nearby, we would not consider them to be at increased risk. That's.
Can I add one more thing?
Go ahead.
The investigation is ongoing, and so you can imagine that there are details that we still do not have, and this is why it's important we're asking you for help in letting our community know, practice the infection prevention measures, because by the time we identify potential risk, several days, frankly, may have gone by. So it is important for people to monitor their health, to be aware of washing their hands and avoid touching their face with unwashed hands, and to stay home while they're sick. So we're asking for the community's help, for all of you to be aware, and so that when we do identify potential at-risk individuals, they'll have already been practicing those things to minimize potential risk to others. So that's what we're asking for, everyone to have that increased awareness at this time.
So didn't the CDC report yesterday that even if you're asymptomatic, you can still transmit the virus?
I don't believe they said that specifically. I know they have said that the role of asymptomatic transmission has still not been entirely clarified, that it is felt that it does not play as primary role as being symptomatic. So the focus, as I understand it, and I'm sure my other colleagues in other jurisdictions understand it, we're focusing on symptomatic individuals.
I think, when I was in Washington, D.C., and we did get a briefing by the CDC and Department of Health and Human Services, they made it very clear that this is a new virus and there is much more that we don't know. They're making assumptions because it is a coronavirus, that it behaves like other similar viruses. So even the incubation period is based on more what other viruses have been rather than specific information. So we are taking what we know and applying it in the best way that we can.
Let me also add that although we don't know everything about the disease, we do know that every case that occurred in the United States had exposure to China or to other symptomatic individuals, a husband, wife, or whatever the case may be. So from the evidence we do have, the only people that are transmitting disease are people who are symptomatic.
Sorry, Bruce, but
Yeah.
Japan has a couple of cases that had no exposure to China and somehow got the virus.
Well, again,
No.
I'll ask Dr. Park to answer that question.
So that is a question that I think partly has to be answered by our federal colleagues, the Centers for Disease Control and Prevention, in that they are monitoring what is going on internationally and notifying us and other jurisdictions about that. But there is growing concern about potential for community transmission occurring in other jurisdictions. Remember that the World Health Organization has announced to all countries to consider the fact and be prepared for the fact that this virus may now expand beyond the borders of China. So that is a potential concern. It just goes back to, again, the importance of the infection prevention measures. Wash your hands, do not touch your face with unwashed hands, stay home when you're sick, cover your cough and your sneeze. I can't emphasize enough how important that is right now.
Dr. Park, I was able to speak with a 70-year-old Hawaii man who was on that ship and is now in the Japan hospital recovering. He is on the road to recovery.
I'm glad to hear that.
He said that he was tested on the ship on February 8th and then confirmed for the coronavirus on February 11th. So there was a few days there where he was in close quarters on that ship with the virus potentially. Do you have any concerns that Hawaii residents who are on that ship and now being treated in Japan are getting the best care and getting immediate care?
So what's happening in Japan is a concern that I have to defer to our federal colleagues. My focus is on what is going on in this state. Of course, I'm very concerned about our residents outside our borders, but our focus is here, and we depend on our federal colleagues, the Centers for Disease Control and Prevention, to ensure that not just Hawaii residents, but all U.S. citizens are appropriately cared for.
What will be the protocol once this 70-year-old man has recovered and then returns to Hawaii? Will he have to go through some sort of 2-week quarantine when he gets back?
So he's already sick and confirmed, so he's in a different category, essentially. He has the virus. So he will most likely not be released until Japanese authorities and or U.S. authorities in collaboration decide that he is no longer poses a direct risk to the public. So I'm assuming we will be notified if there is a concern for Hawaii. If there's no concern for Hawaii, I honestly do not expect them to let us know. That is a private matter then for the family.
Let me add, we've talked about the scenario of passengers from that cruise ship coming back to Hawaii and how we'd handle those. And again, here we would resolve uncertainties in favor of protecting public health. We would be looking at a continued quarantine period for those individuals of 14 days when they arrived here, just to be sure that they weren't transmitting disease. This is a home quarantine or quarantine in their lodging, but we felt that was prudent, not knowing when they might have been infected on that vessel. Could be just before they left. So it's not every case is going to be handled on a case-by-case basis, but as it is, we would be looking for an additional quarantine period for those who are asymptomatic but may have been exposed on the vessel.
This might be a question for Hilton. But what are the hotels doing to protect their workers, their guests?
Not Hilton.
Chris.
Chris, why don't you pull up a chair here?
Yeah.
So, you know, every organization has its own protocol, and as soon as the health department was aware of it, they informed the hotel or the timeshare, and I actually reached out to them and talked to them too. They're taking direction from the health department, but they're in the process, and you probably need to reach out to them to see exactly what they're doing. Every organization has it a little differently, but they're really focused on protecting their visitors and their associates. So I would reach out to them for the details.
Chris, what can you tell the union members? I know that this might be a different question for you, but what can you tell the union members? Because we've heard from them. We know the lieutenant governor met with union members earlier this week, and they're very concerned about their employees going into hotel rooms and cleaning rooms. So what can you say?
You know, I would say that the experience I have and the interactions I've had with the hotel industry and the management teams is they're as focused on all their associates and the visitors. So the expectation is they're going to keep them well informed and follow the direction from the health department on what's the best way to protect them. That's the feedback I've got.
We have worker
Yeah,
safety criteria
guidance.
guidelines that we can speak to. The only class of workers that we feel are at increased risk from this virus are the healthcare workers. All the others, we'd recommend take their normal precautions. Maintenance workers who have safety devices, gloves, and so forth should continue to wear those. But there are no special requirements for individuals with that may be exposed to this virus. It's not thought to impact any particular occupation, including, by the way, airlines, flight attendants, and others, in any special way. But healthcare workers are being advised to be careful and wear their protective equipment when they are working with patients.
As far as this man from Japan, what airline did he fly? And when you investigate close contact, do you look into contacts at the airport as well as the plane?
So at this time, we are still pending the flight information, and again, we're working with CDC colleagues and the Japanese consulate on that, securing that information. We do know he was wearing a mask, so that is helpful. Masks, surgical masks, by the way, are helpful when you are sick to further prevent you from infecting others. So we have been advised that he was, while traveling, wearing a mask. So that is good news to hear. Because it does minimize risk to other travelers. But we are pending that information at this time, and we would be working with our CDC colleagues to potentially identify at-risk travelers.
Why are you pending that information?
Because we've only been just notified. You've not given me time to look at my emails, so thank you.
Would you, when you find out the flight and the airline, would you release that information?
So the way it works, as you might imagine, there have been a number of individuals who've traveled by now, especially from China. And what happens is CDC, Global Migration Quarantine, gets the information, notifies the jurisdictions when there are travelers that potentially are at risk. It's our job to get in touch with the traveler to let them know potentially that what their risk was, and then to put them into home monitoring program. So as Dr. Anderson has already described, so that is how the process works right now.
Sorry, everyone, we just have time for one or two more questions, and then we need
So,
to end it.
Dr. Park, with all the flu cases going on, and this is similar to the
Yes.
flu, the symptoms, how are you going to differentiate who has that
That's a
virus
great,
versus the
no,
flu?
that's a very good question. It's definitely a concern, not just here in Hawaii, but nationally, internationally, because there is a heavy flu season ongoing, especially on the mainland. It is why our medical advisory reminds our healthcare providers, don't forget that common things are common, and that we do need to make sure that before we sound off all the alarms, we need to make sure the regular flu test is done, if not the entire, looking for other more likely etiologies, because that is still going to be more common, more likely than this novel coronavirus.
Can we get an update on the test kits? We saw some reports that they've been flawed or that things are not going well with them. Any update?
The information we have at this point from our CDC colleagues is that they're busy right now reformulating a portion of that kit that was flawed, and their plans are to send that new kit out to all public health labs in the next week. That's the information that we have at this time.
I certainly had the opportunity to talk with the CDC and explain why, from being in Hawaii because of our isolation, the other states were surprised to learn that for us, because we have to ship it back to Georgia and back, that it would take a week or more to get results, and they recognize that Hawaii is a different situation, and they are definitely focused on getting us valid test kits as soon as possible. They recognize that the state having the capability to test in-state greatly accelerates our ability to identify the virus and then take appropriate action.
Governor, Senator Schatz is asking for more money to deal with this. What
Yes.
is
So
our
I
budget?
had the opportunity to speak with Senator Schatz and Senator Hirono, and we exchanged information. They obviously were briefed by the federal counterparts as well. So we all made it very clear about the situation in Hawaii. He is pursuing additional resources from the federal government side to make sure that the response team at the CDC and all the way down through the food chain has the resources they need to appropriately respond to the situation.
But is there an actual budget for this, that the state has for now?
Well, not at this point, not that I'm aware of. I mean, obviously, the state and the local partners are acting within the budgets. Obviously, it's a priority to make sure that we're well-resourced. You know, I don't believe that resource is an issue at this point in time anywhere to the state. We understand that this situation can become very a big concern, and so we want to make sure that the resource is not an issue in the response at this time.
Let me just verify that. We believe we have the resources necessary to deal with this situation. If things change dramatically and we start seeing hundreds of cases, that may change. But the Division of Outbreak Disease Control is well-staffed with expert epidemiologists, and I believe we are in a good position to chase down contacts and so forth. Our laboratory is one of the best in the Pacific area, so they are able to run the PCR tests that we will be receiving, and there isn't any additional cost associated with that at this point in time. So as it is, I think we're in a good position to respond, and if we do need additional funds, those are also available.
Okay, so we need to wrap this up.
Janice, this is obviously going to be an evolving situation. Do you have any advice on those who are here on who should they contact to get additional information?
Oh, they can contact me, email me, janice.okubo@voh.hawaii.gov. So just go ahead and email me your questions, or we can make this available at some point later in the day or tomorrow if needed. But just email me any additional questions that you have.
And we'll keep you up to date as much as we can with press releases and things if there are significant issues that we think you should be knowing about. We obviously wanted you to hear about this and get the facts straight right from the get-go. So we'll try to keep you up to date on what we're finding and our actions as we go forward. Thank you all for being here.